Hello everybody, I'm Dr. Williams and welcome to my Q&A session. It's a 10-minute quickie, but I try to dive deep and come up with some pearls for you. Our topic today is about two antioxidants. They're getting a little press lately for the use in COVID-19 infection. They are glutathione and N-acetylcysteine, and they're both antioxidants, very important antioxidants, naturally occurring in the body. And the N-acetylcysteine is called NAC for short, and glutathione is called GSH for short. I may be interchanging those as we talk along here. And then, and you can read my blog about glutathione and NAC, how they reduce the severity of COVID-19, but also for other viral infections and aging and even sports recovery. So they're both really important nutrients. There's a couple of tricks and tips that make them work better, and I will share those with you. First, a disclaimer, and that is that this video and everything that I talk about today is for educational purposes only. It's for you and I to share and discuss and maybe answer a few quick questions, and how to protect ourselves from the effects of viral infections, particularly COVID-19. Is so important now because this is getting worse. Well predicted, well understood in a lot of ways, the course of the disease. But remember again that the disclaimer that I have to put out is that this is for educational purposes only. It's not to teach you how to practice medicine. It doesn't constitute the practice of medicine on my side, and nor is it designed to provide any specific health care for you, but to provide information and help along the way. And no way does it form any type of doctor-patient relationship, and we're just friends talking, basically. So remember, as we get started, that there's only one way not to get sick, and that's not to get infected. So if you're not exposed to an infectious disease, whether it's the flu, a cold, dengue fever carried by mosquitoes, or Zika carried by mosquitoes, or malaria carried by, so if you don't get bit or you don't get exposed or you don't get coughed on, then you won't get sick. Now, that's a big topic to talk about. Maybe it's important to get sick once in a while. It makes us stronger, it makes us more resilience, and immunologically speaking. But once you do get exposed, you're likely to get sick. Not everybody will, but most will. And to have a robust response, immune response, is really important. But that response has to be stable and balanced, and not like a yappy watchdog who barks at every little sound or movement or yap and yap. That creates problems in your body, and the immune system can kill you faster than the disease. Believe it or not, that's what happens in a lot of these conditions, is that the immune system becomes so aggressive, producing cytokines that accelerate inflammation to a level that you can't get that under control, and your own system takes you down. So it has to be a balance between the infection and your immune system. Now, last time we talked about the T cells and the thymus gland and kind of that first response. This time we're talking about antioxidants and their use in managing the response. So really what we need to do once we get sick is we need to have a disease management protocol, or an understanding of how to do that. Vitamin C is very important, and we'll talk about that in another lecture, because there's so much to look at in vitamin C. But with glutathione and NAC, it's pretty straightforward. It's well understood. There's lots of research, and it's just being brought out recently to manage COVID-19 infection. So the first question we're gonna look at is, can GSH, that's the glutathione, or NAC supplements reduce COVID-19 symptoms? Maybe, but maybe not. And I would say clinically, probably not. Probably if you take these, you're not going to notice as the same type of reduction in fever that you would with Tylenol, acetaminophen. These are disease-modifying substances and tissue and cell protective substances. So you may not notice that your symptoms have gone down, but don't stop taking them. Continue to take them. And the real question is, can they, along with other supplements and nutrients, modify the course of the infection? And that's what you really want to do, is modify the course of that infection. I call it bending the curve. So it's a personal bend of that curve. Instead of going up, it goes down over time. So, but not too long, because with an acute infection, you don't have much time. You have to get on it very quickly, and you have to modify that. However, COVID lasts a long time. It moves and shifts and goes on weeks and months and 4 months, 6 months, and then we still don't know about post-infectious syndromes. But yes, we can use glutathione and NAC supplements to modify the course of the infection. It seems to work, and details are in my blog. Just came out this week. Glutathione and NAC reduced the severity of COVID-19. And these are commonly obtained in the health food store online or through my website. And so how do you use them? I think that's what's most important. And definitely you have to include them in your COVID toolkit. So glutathione doesn't absorb well through when you take it by mouth. So we've been using glutathione for decades, but most of us stopped using it in the naturopathic profession and integrative medicine a while back because it really wasn't working. And for a while we didn't know if it was working, but we didn't see any changes in the antioxidant status, and it was assumed that it wasn't absorbing. Then we started to have studies, but they were expensive, research-based studies to measure glutathione. Now you can get your total glutathione measured at LabCorp Quest with your doctor's orders, or go through direct labs or any lab, and you can order that yourself. That way you know what your status is to begin with, and if you're taking these substances, if they're working. That's called a total glutathione lab test from Quest Diagnostics or LabCorp. And what you want to do is you want to take reduced glutathione or liposomal glutathione, and now those are readily available, not just plain glutathione. And then you need at least 200 milligrams per capsule, or 2 100 milligram capsules, or liquid. They have it in liquid. Then you have to measure out how much is 200 milligrams, and you need to take it frequently, 4 times a day. When should you start? Well, you should start pretty right away. And if you want to have better prevention, if you're not sick and you want to get ahead of the curve, then get your glutathione, total glutathione status measured, and then start taking your supplements, and then measure it again and see if it goes up into the normal range. Desirable ranges are going to be at the upper end of the normal range, or a little bit higher than the normal range. Undesirable would be less than midway, and of course deficient levels, you need to take more. And then NAC, N-acetylcysteine, is best taken in what's called a free-form NAC. An adult dosage is 600 milligrams twice a day. During active infection, you can increase the dosages, or the number of times you take these substances. So you could increase the reduced glutathione or liposomal glutathione, 200 milligrams, from 4 times a day to 6 times a day, or you could raise the dosage, say, to 400 milligrams 4 times a day. And the free-form NAC, 600 milligrams is enough. You could take that up to 4 times a day. Now, in addition to that, to really successfully get into your system, You can have IV or intravenous, a glutathione, not a push, but it's a slow drip. But they're small bags, and they can go in pretty fast. So usually in our office, the average dose of glutathione is 4 grams, that's 4,000 milligrams, in a small bag of fluid that's dripped into your vein over about an hour, something like that. And there's usually no trouble at all with the glutathione. Almost all patients feel a little bit lighter, a little bit clearer headed, a little bit, and I know I do. And you can also take an intravenous vitamin C infusion before the glutathione. So you do the vitamin C, sometimes with minerals, trace minerals and electrolytes, 20 or 25 grams for an adult. And then when that bag is done, you can, sometimes the doctor will add in the glutathione right at the end of that bag or put on a separate bag. We always use a separate little bag. So, and then, but we just transfer them over smoothly. And the vitamin C takes 2 to 4 hours, so it's a little long. And as I said, the glutathione takes 1 hour or sometimes less. A way to get NAC into your system better than orally is through a nebulizer, a mister, or a tent. And the only thing here again is that you need a doctor's help on that, and because it's a prescription when it comes in a sterile vial, and you use 3 to 5 milliliters. An adult would use 5, and teenagers or 10 or 12-year-olds would use 3 mLs of the 20% solution, and it also comes in a 10% solution. So it's a little bit irritating to the mucous membranes, and you might start off with a 10% or lower dose, and then doing that 3 times a day. So that's a nebulizer, that's a mask that goes over your face with a strap behind your back, or in a tent, the old-fashioned way of putting Vicks vapor rub and putting the kids in a tent made from chairs and a blanket over the top, or just inhaling, off the stove, and without the flame on, of course, but just inhaling the steam off of that. So those are the ways to use glutathione and to use NAC to benefit your health. I believe they work. I believe they're useful. Based on my clinical experience, the evidence for their use in influenza and aging and other health conditions where there's lots of antioxidant activity going on and oxidative damage happening, then you find that the research is very strong. There's very little on the use of glutathione for COVID, but there's some, and in a study from England, and there's from the Center of Evidence-Based Medicine at Oxford University, they were not convinced that the studies were sufficiently strong enough, and there were so few of them, they really couldn't make a decision. However, they acknowledged that there was very strong evidence of using glutathione as an antioxidant and for influenza, and therefore managing oxidative stress from viral infection and managing inflammation, which is, as I mentioned when we started talking, is that you want to manage the course of the illness, and you want to manage the inflammation created by your own body's immune response, and you want to manage the cell damage, because there's going to be cell death from the infection, and those have to be processed out of your body, and the oxidative damage as the tissues are changed, transformed, attacked, and by the virus, it becomes severe, and that's like having a lot of debris in your system. Now that these are microscopic amounts, correct? But the in terms of the internal environment, it can be huge, and it can tip your way of coming back from the infection one way or the other, and the way that is cleared from your system is through what's called a biological matrix, and that's part of your lymphatic, or connected to your lymphatic system, and that flows under the skin and then through every unit, every part of your system. That's called the intradermal matrix, and sometimes we just use the word matrix. And so supporting the matrix by drinking lots of water and taking the glutathione and the NAC will give you an advantage for disease modification for COVID-19, either to speed up, reduce the severity, or in some cases save lives. I'm happy to take any questions, and I see a number of my friends and colleagues here, and some of my patients are on, and thanks for joining me. I really appreciate it. Any thoughts or questions for me? So, what you want to do is you want to read my blog, and then that tells you exactly what to do and what to take and how to do it. And reach out to me if you have any questions and or want more information. Please reach out to me and follow my work on my website, drjewilliams.com, and of course my books. I have 2 books on viruses, 20 years ahead of everything, everybody else, but not everybody. There's some really smart people who have been working on this, not just me. They're available on Amazon. That's Viral Immunity and Beating the Flu, and of course you follow me on Twitter and Facebook and LinkedIn. I like to use LinkedIn. And for long reads and more thoughtful, find me on Medium. And I have a few questions. And one is there a brand of vitamin C that I recommend? I use what we call pharmaceutical grade supplements that have there's paperwork behind them, so they have all of these statistics of how they're manufactured, their purity, and so forth. And every single supplement I use, I'm able to obtain that from the companies. And the two most common professional lines that I use are from pure encapsulations, and you don't need any special form of vitamin C. Ascorbic acid works just fine. In other words, you don't need ester C or these other type of more expensive Cs. Ascorbic acid works great. However, a buffered form, buffered ascorbic acid, takes the edge of the vitamin C off when you're taking high doses, because the word is ascorbic acid, so it is an acid, a nutritional acid, and it's a little bit harsh when you take, for some people, and having it buffered with some electrolytes. They usually buffer with potassium, sometimes with magnesium, or sometimes both, and then makes it a lot more compatible. And the dosages vary. But at least you need 2,000 a day, and then for treatment you need to work it upwards to maybe 10,000 a day. As you know, if you take too much vitamin C, it causes diarrhea. So that's not that it doesn't mean it's not getting in your system, but some of it is being excreted. So you need to back off if you cause diarrhea, or if you take too much at once. So you need to find that optimal dosage for you. And And another question is, does NAC encourage the production of glutathione? Absolutely. That's why we use NAC, because it's a precursor to and promotes the effective operation of glutathione in your system. So you want to take both, not just one or the other. Now, NAC by itself is also a mucolytic thins the mucus, and so if you're having difficulty breathing, NAC, and there's a sticky phlegm, NAC is very useful. It's mild compared to guaifenesin, for example, which is an over-the-counter product that's also very useful. But NAC thins the phlegm over time and helps the body process it, so you're not spitting it out or coughing it up as much as you would with guaifenesin, but the body is processing that sticky mucus out. And so you take the NAC and glutathione together, one supports the other. Another question is our IV room in our clinic operational? And the answer is yes. We haven't stopped treating patients. We do not take active. We don't take in active COVID patients with active infections. So we screen all the patients. Everybody wears a mask. All the staff are wearing a mask, and we check temperatures and everything. We haven't had any infection out of there. All of our staff, including me, was just tested last week again, and we'll continue to do testing every few weeks. And all of us were negative, including me. So we're still good. And another question is, is NAC on the full script site from my practice site? Yes, you can get the NAC on the full scripts or Welevate through Emerson. I use both of those. So thanks again. We ran over a little time, but I appreciate you all, and please stay safe and follow me if you have the time. Come back. I'll be trying to answer questions on a regular basis and helping you stay safe, stay alive, and be well, and live long and healthier. Bye.